One of the fastest ways to understand Medicare is to understand the difference between Medigap and Medicare Advantage. If you understand these two paths, everything else starts to make sense. I talk to people every single week who feel overwhelmed. You're hearing about parts A, B, C, D, and then there's letters like G and N. You might see ads or get calls promising money back, groceries, gift cards, but they don't actually explain what the plan is. I'm Pam Turner, the creator and facilitator of the Medicare Facebook group known as Navigating Medicare the Easy Way. I help you to get rid of all those fears and worries about getting onto Medicare and enrolling in the right plan by streamlining the whole process for you. How are you supposed to make a decision when you don't even know how Medicare works yet? Here's how I simplify it. You don't have hundreds of options. You have two paths, Medigap or Medicare Advantage. Today, I'm going to cover why these two plans are complete polar opposites, how the costs and risks compare, how to decide which one fits you, and the things about Medicare Advantage that never get mentioned. Grab a piece of paper if you can, because in a few minutes I'm going to give you some specific points to write down that will help you to remember the difference between these two plan types, and by the end you're going to have a written guide to refer back to. There is a really blurry line separating the difference between your original government Medicare and the options that you have through private insurance companies. I want you to keep in mind that before you make any plan choices, you need to sign up for your original Medicare on time so you don't get any penalties. No matter what you choose to buy through private insurance as a supplement, you'll pay that same flat fee ongoing for your Part B of Medicare. For most people this year, it's $202.90 a month. There's two reasons that people buy additional insurance over and above original Medicare. Number one, you can run out of hospital days on Medicare. And number two, there's no out-of-pocket cutoff to the amount that you might have to pay in a calendar year on Medicare. All other health insurance in the U.S. has this maximum out-of-pocket cutoff protection, but Medicare does not. So what is a Medigap plan and what is a Medicare Advantage plan? Your Medigap plan is an insurance policy that you buy from a private company, and its job is to pay your Medicare copays for you. Buying a Medigap plan keeps your original Medicare as is, and Medicare stays as your primary coverage, meaning Medicare pays first. A Medicare Advantage plan is a different way to get your Medicare through a private insurance plan. Sometimes it's described as a Medicare replacement plan. Now it's time to start writing down some points to compare these plans, and I'm going to continue breaking down the differences as I go along. If you were able to grab a piece of paper, draw a line down the middle of the page, and on the left-hand side write Medigap, and on the right-hand side write Medicare Advantage. Under the Medigap side, write keeps original Medicare. Because choosing Medigap, you keep original Medicare exactly as it is. Under the Advantage side, write down replaces original Medicare. Because when you enroll in a Medicare Advantage plan, you replace how your Medicare is administered. Now let's pause for a moment for me to break down what that really means for each plan. Then we'll jump back into writing down more notes for your side-by-side comparison. For this section, just listen. Now I'm repeating myself just a little bit here, but this is how you learn. A Medigap plan is a policy you buy from a private company that pays Medicare's leftover bills for you. Medicare stays primary. When you go to the doctor bills Medicare, Medicare pays its portion, and your Medigap plan automatically pays its portion. Why is this important? Your doctor only needs to accept Medicare. Therefore, there's no networks with Medigap, no referrals, no prior authorizations in most cases. That's why people describe it as freedom and predictability. Even billing departments sometimes misunderstand this, but the rule is simple. If they take Medicare, they take your Medigap plan. Now for Medicare Advantage. When you enroll in an Advantage plan, Medicare now pays your private insurance company to administer the Medicare benefits. That company becomes responsible for managing your care. You're still on Medicare, but Medicare is no longer paying your claims directly. So it feels like Medicare is being replaced. That means now the plan's rules apply, the plan's network applies, the plan's authorization rules apply. That's why brokers must get permission before discussing Advantage plan details, because these plans are more confusing and they're easier to misunderstand. So already you can see how they're opposites. With Medigap, Medicare pays your claims first. With Advantage, the private plan manages your claims entirely. Next up, monthly costs. let's talk money. Medigap plans typically have higher monthly premiums. Advantage plans often have low or more commonly zero monthly premiums. Now, in case you didn't know, the word premium is one of those insurance terms that gets thrown around that simply means the cost of the plan. Premium can be monthly, quarterly, or annual, but for the sake of this topic, when I say premium, I'm typically referring to the monthly cost of the plan. So back to your piece of paper, under the Medigap side, write down higher monthly premium, and under the Advantage side, write down lower or zero premium. But you'll see as we go along that monthly premium is not the whole story. How about predictability? Medigap plans are predictable. Benefits don't change year to year. Plan G is Plan G. The benefits just never change. Advantage plans can change every single year. Copays, networks, covered drugs, extra benefits. So under the Medigap side, write down predictable, and under the Advantage side, unpredictable. Another thing you can add to your notes, and I'll tell you what to write under each side in a minute, is that even though Medigap plans are predictable, their rate increases are not predictable. So under the Medigap side, you can write down lifetime annual rate increases, and under the Advantage side, low or zero rate increases. Where they sneak in the increases with the Advantage plans, though, is that they may reduce benefits over time so that they can keep the majority of the Advantage plans at zero monthly cost. This falls under one of the many reasons why Advantage plans are unpredictable. And what does that mean to reduce benefits? Well, that might mean a way jacked up max out-of-pocket number, the copays might be higher, and so on. Now, financial risk is something people don't necessarily consider when it comes to getting into the details. You just may not think about it specifically. This is where you'll see a huge difference between the plans. With Medigap, your financial exposure is mostly your premium plus a small deductible. So your maximum medical exposure is really easy to calculate. It's the premium times 12 months plus deductible, which typically is just that Medicare Part B deductible, which this year is $283. That's it. That's a one-time in a calendar year. Now, with Medicare Advantage, your risk is measured by the plan's max out-of-pocket, which does happen to go up every year. Now, Medicare currently allows Advantage plans to set that number as high as $9,250 in network. Many plans are lower, but that's the highest allowed amount. All copays and coinsurance go toward that max out-of-pocket number that you pay throughout the year. So you can write this down. On the Medigap side, lower financial exposure, mostly fixed. I'm going to repeat this because this is a little bit longer. On the Medigap side, lower financial exposure, mostly fixed. On the Advantage side, write down higher potential exposure with an annual cap. Again, that's higher potential exposure with an annual cap. Here's something important to understand about Advantage plans. When you see 20% coinsurance listed in the summary of benefits on an Advantage plan, how much is that? 20% of what? You don't know. It's 20% of the plan approved amount for whatever service up to that max out of pocket. So you can see how there's looming costs built in that are unpredictable. The only way to understand your true risk on an Advantage plan is that max out of pocket number. Now, what about restrictions such as plan rules and networks? Medigap plans have no networks and virtually no prior authorization requirements. This means fewer restrictions. You can see any doctor that accepts Medicare nationwide. Advantage plans have doctor networks, possible referrals, and require prior authorizations, and in most cases you have to stay in your local plan service area except for emergencies when you're traveling. So you can write down under the Medigap side, few restrictions, and under the Advantage side, many restrictions. For some people, it doesn't bother them at all, especially if you've had a group health insurance plan through your employer with the exact same types of restrictions and even higher deductibles. For others, though, it matters a lot. Maybe you're tired of that. Some people are ready for some predictability and the full coverage that Medigap plans offer. Next is we're going to learn where the drug coverage fits in. That's Part D. Medigap does not include drug coverage. You must buy a standalone Part D plan. Advantage plans usually bundle in the drug coverage. So under the Medigap side, write down must purchase a Part D drug plan. And under the Advantage side, write down drug coverage bundled in. How about switching plans later on? Maybe you want to know, okay, is this going to be easy or difficult, if you decide that you're not happy with one or the other? This is where a lot of people don't get the full story when they first sign up. If you start with Medigap when you're first eligible, you typically have a one-time guaranteed enrollment window with no health questions. If you leave Medigap later and come back, in most states, you must pass medical underwriting. That means you can be denied. Advantage plans never require health questions. There's a 12-month trial right when you first join an Advantage plan at age 65 or later later if you leave Medigap and you get Advantage for the first time. It doesn't apply to everybody. There are little nuances to it, but the big takeaway is that you can always move from Medigap to Advantage. You cannot always move from Advantage to Medigap. That's something the ads and phone calls don't explain. So under Medigap, write down might require health questions later. Under the Advantage side, never requires health questions. When it comes time to choose, how do you decide? There's no one best plan because of how personal this is. There's only one that's better for you and you alone. Now ask yourself, how important is provider freedom? How comfortable am I with financial risk? For instance, what's the most you can afford out of pocket in a year in the event of a catastrophic health event? Ask yourself, do I prefer paying a premium knowing I would have very little out-of-pocket expense later, or lower premiums knowing I'd be paying co-pays for everything as I go? Would I be comfortable navigating authorizations if needed? Some people love paying as little as possible monthly and don't lose any sleep over possible risks on an Advantage plan. So ask yourself, does this sound like you, right? Others want stability and predictability, even if it costs more in premiums month to month. Neither way is wrong. You just deserve upfront to understand both concepts before choosing. Finally, what are some of the things nobody talks about? I already touched on what I'm about to say, but I want to reiterate it. If you've ever worked with someone really intent on selling you an Advantage plan, I'd be willing to bet that they never talked about how you may never qualify for a Medigap plan again. That you only get one free shot to get a Medigap plan in most states. I'd say that's pretty important to mention. Maybe it doesn't matter to you because all you want is an Advantage plan anyway, but still you at least deserve to know this information up front. There's several things also about Advantage plans that don't get mentioned much, so you'll notice this when you're researching. It's important to look at the summary of benefit for any copay that has a percentage. For example, if you need chemo, you pay 20%. Well, 20% of what? I already said this earlier. See what I mean? You have no idea what your bill will be when it says 20%. The only way to know what your maximum risk is by knowing the plan's out-of-pocket max in a year. This is the cutoff to what you'll pay in just in a calendar year. It resets every year. And how high that number is where the risk comes in. When you know this number, you would know that chemo is 20% of the plan approved rate for chemotherapy up to that max out-of-pocket cutoff. If you love the idea of paying as little as possible monthly and the max out-of-pocket can be covered by you easily in the rare event that you were to hit it, then that plan type is a good fit for you. It's also a fit if you're not bothered by network limitations at all or having to advocate for yourself. If a service is denied and maybe you have to submit an appeal to try to get it covered. On the other hand, if these things make you nervous, you feel anxiety, not being able to see any doctor that you want to see, and the Medigap plan premiums are affordable to you, then Medigap is most likely the best fit. Personally, I can't stand the idea of being limited to only being able to see certain doctors. But my mom, on the other hand, she loves her zero premium Advantage plan. She doesn't lose any sleep over the restrictions. The thing that gave her the most anxiety is when prior she was on a Medigap plan, and those increasing Medigap premiums, they just kept increasing every single year. And so that really stressed her out, and she couldn't wait to get off of that. Now, if you want help comparing real pricing and real benefits in your zip code, I can walk you through it step by step. I can help you enroll in Original Medicare correctly, transition from employer coverage if needed, compare Medigap pricing, review Advantage plan benefits, understand your maximum exposure for your situation, and make a decision that you feel good about, not pressured into. My help is always 100% free. You can book a time with me directly over at decodingmedicare.com on the contact page. There's no reason to struggle through this or rely on information that's online that only tells part of the story. The right plan is going to be the one that fits your comfort level, your finances, and what your priorities are. So enjoy the rest of your day, and I will see you in the next video.